Hi, I'm Dr. Kimberly Lentz, and I'm really glad that you're here today and having an interest in your health. And I would like to go over some of the specifics of your screening that you had recently. I'd like to start with your CBC. When you look at your CBC, the first thing that you see is your white blood cells. Those can be an indication of whether or not you have an infection. So if your numbers are too high, it could mean that you have a bacterial infection. If they're too low, it could mean that you have a viral infection. There are other things that could raise or lower that number that are less common. And if your results are out of the range of normal, you probably should show these to your primary care doctor so that they can do further evaluation if necessary. The second part of your CBC involves your red blood cells. The numbers on your test results are the hemoglobin, the hematocrit, the RBCs, MCV, MCH, MCHC, and the RDW. Those all center around your red blood cells. And doctors generally look at those as a whole, not just as individual. If you look at it from an individual basis, the hemoglobin is probably the one that we look at most specifically. That tells me whether or not you're anemic. So if that is low, it means that you have anemia for some reason. It doesn't necessarily tell me the reason why you're anemic, but just says that you're not making enough red blood cells. You couple that with the hematocrit and the red blood cells and the MCV and those other ones to try to get a better picture of why you might be anemic. For example, if your MCV that's on your report is low, that could indicate that you don't have enough iron. If it's too high, it could indicate that you don't have enough B12. And so your doctor would need to do some additional testing based off of these results to determine why you would possibly be anemic. The hemoglobin level can be elevated. It's not necessarily a problem. We see it most commonly elevated in people who smoke. So if they smoke, their body isn't getting enough oxygen because of their smoking, and so their hemoglobin may increase in order to compensate for that. So you kind of look at all of those together as a whole. Individually, they don't necessarily mean anything by themselves. For example, if your MCHC is the only laboratory value that's off a little bit, all by itself it doesn't necessarily mean anything. Your doctor would want to look at all of those labs together to make an assessment of whether or not you have an issue with your red blood cells. The last thing that you'll see on your CBC is your platelet count. Platelets are the cells in your blood that clot your blood, so that when you get cut, you form a clot and a scab and that heals over. So if your platelets are too low, you may have trouble with bleeding. So if that's out of the range of normal, again, your doctor would need to do some additional testing to try to determine why those may be low.